The patient chart screen. This screen allows the provider to review the patient's chart and document the physical, assessment, and treatment plan. The patient chart screen contains a great deal of information and gives you access to many functions. This screen defaults to display the most current patient appointment or encounter. From this screen, you can also access the patient's past appointments, denoted by bars on the encounters list, which serve as visual indicators for past visits. How do you access the patient chart screen? You can access the patient chart screen through several ways. From a patient's demographics screen, you can view the patient's chart by selecting the View Chart button in the bottom menu. From the waiting room, you can view a patient's chart by selecting the patient's name and selecting the View Chart button in the menu displayed. From the checkout room, you can view a patient's chart by selecting the patient's name and selecting the View Chart button from the menu displayed. From any of the treatment rooms, you can view a patient's chart by selecting the patient's name and selecting the View Chart button in the menu displayed. There are several main areas on the patient chart. Patient Information section. This area of the screen is available from all the tabs on the upper portion as well as at the bottom of the screen. It helps the provider determine that the correct patient's chart is displayed and gives a quick view of certain vital signs and other patient information. Assessments and Treatments display. This is the large text area in the middle of the screen. Items that pertain to the current encounter appear in blue. Items that are still open but were documented as part of a previous encounter appear in black with the date ordered. Patient information in this large text area can be displayed in 4 different formats, accessible by clicking on one of the 4 icons located at the bottom of the large text area. The first icon shows each open assessment with its corresponding open treatments. The second icon shows all the open assessments, followed by all open treatments. The third icon shows all open assessments only. The fourth icon shows open treatments only. The fifth icon shows everything that occurred in the current visit in chronological order. The sixth icon shows new information only. This sixth icon is a toggle button. When selected, only today's data will be displayed. When it is not selected, all open treatments and assessments will display on the SOAP screen or large text area. Today's data will be displayed in blue, and data from previous dates will be displayed in black. Encounter list. This is a list of the patient's past encounters or appointments that appears on the left side of the screen. The encounter bar displays the encounter date, visit type, the status of the appointment, whether it is open or closed, and the provider's name. The encounter bar is color-coded to the provider who owns this visit. A scroll bar will appear when the list is longer than can be accommodated in this area. Select the Sigma button to the right of the colored bar to view the encounter summary report for that encounter. In some instances, selecting the Sigma button will show a menu of options to select from. Tabs. The tabs that appear above the large text middle area on the patient's chart will depend on your specialty. Buttons. A menu of options appears on the right side of the screen. Select the Other Items button to view the entire menu. An important note for physicians and clinic providers. As you commence the examination of a patient, the encounter bar representing the patient's ongoing encounter, which appears at the top of the encounter list, should be in your designated or assigned color. If it is not your assigned color, check the narrow bar at the top of the screen to see which user is currently logged in. If another user is still logged in, select the Exit tab at the bottom right of the screen, then select the I'll be back button to exit the patient's chart. Select the Log Off tab on the Office view, then log in with your ID and password.